Good afternoon. My name is George Ferrari, and I serve as CEO of your community foundation. Welcome to our Let's Talk for the month of November 2021. We're happy to have Gary Stewart and Penny Givens from the Cornell University Office of Community Relations with us. Our topic today is campus, community, and COVID. These are 30-minute quick conversations about issues within the mission-driven sector. We're very happy and excited to have Gary with us and Penny. We have upcoming events for Let's Talk as well. December 7th is our next one. The focus there will be on immigration. Steve Lair, a local attorney working on immigration issues, and Kandikili Sakone, who's on our board, is also an immigration attorney. We'll be talking about that. And then we have additional planning happening in 2022, which is not that far away. So you'll have a chance to ask questions in the chat box. Nancy Masici here in our office will be watching that. I'll turn it over to Gary and Penny right now. Welcome, Gary. Thank you for being with us.
Well, thank you, George. And it's great to see so many people I know. And I have to give a special shout out to one of my mentors, Nina Miller. And Nina, I was so fortunate to be on the hospice board many years ago. And I've been on a lot of boards over time, but that was one of the best board experiences I ever had. And I learned a lot from Nina and my colleagues on the board. So Nina, thank you once again, and it's great to see you. I'm grateful for this chance to talk about an interesting, challenging, and in many instances gratifying 20 months, and to take your questions. If I don't know the answer, I'll get you one by the end of business Wednesday. I'm going to be brief with my comments as I'm far more interested in your comments and questions than I am listening to me prattle on. So we'll get after it. Slide one, please. This is the homepage of Community Relations website, and the link to that's in chat along with my email address. I like these images because it reflects in part some of our work, which most importantly is community relations, not public relations. There's a big difference. In the mix here is an image from April 2020 when Cornell campus-to-campus buses transported local doctors, nurses, and other healthcare professionals to assist medical personnel in New York City. The story about that is in chat, and though it seems like a long time ago, I still got a little teary today reading that story earlier today. One of the quiet successes of COVID has been an unprecedented amount of steady collaborations, information sharing, and strategizing between the campuses, local, state, and federal governments, our business and nonprofit communities, Hugo Medical Center, and the Tompkins County Health Department. Since the spring of 2020, a core group has gathered every Monday morning at 8:30 to share data and updates. This meeting includes campus directors of student health, county leadership, and Cornell colleagues based in Albany, who provide key information on state initiatives that may soon be released or in the planning stages. We highlighted these special partnerships at the 2020 Town Gown Awards, covered from that's in chat, and it only has grown in effectiveness and importance over the last year. Slide 2, please. We have archived all our campus community outreach since March of 2020 on this page, and the link to that's in chat. This includes key updates on campus data, COVID-related outreach through our weekly radio show, All Things Equal, our twice monthly newspaper column, East Hill Notes, and past and present platforms, including community relations office hours, our current Town Gown Tuesdays, and an archive of about 60 past community meetings. If you look at these past community meetings, we have visited several groups more than once, and they're always available to meet with groups on all things COVID or anything else, could be the economy and going forward, things like that. So just let me know. We do things called drop-ins. Well, we'll say, I see you have a regular board meeting coming up. Do you want us to stop by for 15 minutes, give you an update about what we're doing, and then we'll get out of the way. We're also willing to come for longer presentations and to take questions. So you can see in this mix is everything from business leaders to neighborhood groups and of course local government. So it's been daily work and very satisfying and gratifying at several levels. Next slide, please. This site is Cornell's main site for current data and key updates. If we open up the dashboard, you'll see it includes steadily updated data and the current campus alert level. If that level ever changes, currently it's green, we send a notice out to community listservs notifying them of that change and why. There's also updates there, including recent messages, specific information for students, faculty, staff, and visitors. And again, the links to all this are in chat. Finally, I'd be remiss if I didn't note that the 2021 Town Gown Awards, aka the Togos, are coming up November 20th at 10 a.m. And sadly, we're going to be virtual again, but it was a tough call. We want to be back at Ithaca High School's Culp Auditorium in 2022. This year's Togos will feature remarks from Cornell President Martha Pollack, highlights from 3 key Town Gown partnerships led by community members, students, staff, and faculty, and a very special thanks to more than 30 community leaders who have or will be retiring from elected or appointed positions. It's more than twice as much as any other year. We do this every year with retirees. And so a lot of folks that many of you know have or will be leaving their jobs. And it's so important to give them a tip of the hat, because one of the things I think about Ithaca, and I've lived here 30 years, 10 doing newspaper work back when there's a paper, and then 20 up at Cornell. I don't think we thank each other enough on a day-to-day basis. This is one time a year where the focus is thanks to people that keep our community such a fantastic place, and often under the radar, just doing quiet, selfless work for the common good. So I'm not gonna go on anymore. I really want to hear what you folks are thinking. I want to hear about what we could be doing better as a university in terms of communications and clarity, and look forward to any inputs on that, because it's been quite a experience at many levels, and you know, and compounded by this little event we had up on campus Sunday, which just was like another, okay, now what are you going to throw at us? But that went well. And I tell you what, I can't thank local law enforcement agencies enough for the work they did with Cornell Police and then the administration. It was a busy day, but it just represented the best of the community, and very, very thankful to everyone who helped us out.
Thank you so much, Gary. There's always a lot of really good information on your constantly updated website resources. Really appreciate that very much, of making that so transparent and available to us. So as you have questions, you can put them in the chat box. Nancy Masici will be managing questions for us from our office. Turn over to you, Nancy.
Okay, well, as Gary mentioned, there are Togo Awards for 30 upcoming retirees. So one of the questions is, what is Cornell doing to remedy serious shortage of staff? Specifically, it says Cornell Student Health.
Yeah, I mean, I don't think there's a part on campus that's not dealing with these issues, and I think it's not unique to us. And I talk to IC every week, same thing over there. And then when you think about like student and campus life, just over there, like getting folks within dining and other places, and same for facilities. And then Cornell Health, and I know many of you must know Sharon McMullen. Sharon started her job in January of 2020. So she did not just get to slide into this her position. And there's a lot of talent in that building who have lots of career options. And so it's been a struggle to just maintain a full staff, especially since March of 2020. And I got to say, whenever I'm walking down Ho Plaza and I'm taking someone on a campus visit, I always point at Cornell Health, and I'll say that's the toughest place to work in on campus by far. It's the toughest building to work in on a day-to-day basis. So I'm sorry, I don't have a specific answer to that question. I will loop back with Sharon today, try to get something a little more specific, and I know she'll appreciate the interest in that the community has within the important staffing levels at Cornell Health.
Great, thank you, Gary. I'm going to squish two questions together that have to do with the pandemic and making residents safer, regarding Cornell's decisions about how you're managing that. For example, can you insist that Cornell students wear masks when they're in the community like Wegmans?
No, I mean, we could suggest, but there's no enforcement, once people are off campus, and it's something that we're concerned about. It's something definitely I hear about in my office every day. Just as an aside, I had one of the most gratifying professional experiences last year when we announced that we were going to bring students back, and people were understandably very, very nervous. And there were times I would just say, oh my gosh, let's go down to Stewart Park and take a walk and talk this thing through. And for the first time since I've been here, several months later, after the students came and things were okay, some people actually reached out and said, I'm sorry that I was so nervous. And it's I just was like, this never happened to me before. Like someone actually called up and said, I'm sorry about that. So, but it was I honestly think that the unsung heroes in this whole thing that we've been through are the students. The students are missing out on large chunks of their college lives. By and large, they do a great job on campus. They're still 18 to 23 years old, but they've shown real leadership and responsibility at many levels that might not be obvious to the off-campus community. So sorry to interrupt. What's the second part?
That was it. You covered it. It was basically about the pandemic and making residents feel safer. So you just mentioned students, Gary, and the question is, are students being encouraged to volunteer in the community again?
Yeah, and we're working on some projects tied to that. And we're trying to find a more efficient portal for nonprofits and other organizations to put their needs into this place that students can access and then respond to things they're interested in. I always want to be an advocate for students. I didn't go to Cornell. I'm not blind about the place. And I always say, like, we're too big not to screw up. But the students are sometimes they're so easy to stereotype, and someone will say something about the students, and I'll say, do you even know any students? Or is it just like a faceless group of people walking down the sidewalk on a Friday night? But if anybody here has an immediate need that students can help with, reach out to me until I get this other portal going, and we'll connect them, because they're itching to get back to some sense of normalcy. They know how important the community is. And so many of the students, even before they graduate, have a great affection for Ithaca, and that grows over time. That they remember their days here in Tompkins County, New York. So please let me know, and I'll let George and Jennifer and other folks know when we have this portal up and running and a little more fine-tuned.
Okay, great. Gary, would Cornell ever consider allowing community members to have their testing done on campus? For example, sometimes it can be difficult to get tested in this community. One person finding that.
I've heard the question before. I think that the answer is difficult just because it's such a busy environment, and coming on campus, as everyone on this Zoom knows, is not an easy thing. And I think us trying to work that into our stuff, and the incredible amounts of testing that has to go on, especially with students, I don't know if logistically it would be possible to do it at the standard that we want to meet. We want to meet an excellent standard, and I think it would be difficult in terms of coordination, follow through, little stuff like parking or access. I've heard the question before, and I think that with the students and how often they have to get tested. I think we're doing about as best we can with that volume.
Yeah, there's a lot to do there. I know there's someone's been sending me chats. Ian has a question for Gary. He said it's a little complex. So Ian, why don't you go ahead and ask your question? Unmute.
Hi.
Hey.
Hi, Gary. I'm Ian. I work in admissions for the ILR school. And thanks, Nancy. Yeah, I was thinking of typing this and it'd be easier to ask. You know, I wanted to get your thoughts on something. It's something I've actually brought up to HR at different levels here over the years, and I've never been able to get a clear response to it. One of the things in the community that I always wonder if we could do a better job at is there's so much untapped potential in the community in terms of people who would want to complete a degree. It could be an associate's, a bachelor's, a master's, or sometimes it could even be taking a class or two at Cornell. And even if they work at Cornell, sometimes it could be cost prohibitive. As you may know, the tuition benefits, the way they play out in terms of what someone can take in a year without having to pay the taxes on it, that amount hasn't adjusted in like a decade or two. And I mention this because I'm an employee who has these benefits and I'm not going to use them, and I'm never going to use them. I got my master's, my terminal degree at Cornell. So I feel so fortunate to have access to these things, but I'm never going to use it. And so I'm bringing this up with you because I always wish there was a way, just as when there's an employee in crisis and I can donate my health leave to them, I always wanted Cornell to take a big swing at improving relations with the community. I would love us to find a way for employees who want to donate some portion of that benefit to people in the community. It could be an elected official or someone who's on a board, and they would love to be able to take a class here in nonprofit finance and management, or someone that wants to learn a little bit more about desktop applications. So I put that to you because I think it's a way, it wouldn't be too costly a way, even if it's not my full benefit. Could I donate it to someone who wants to apply to these jobs that are open, but they think Cornell is so obsessed with the credentialing? If they don't have this degree, if they don't have a recent coursework that shows expertise in a field, then maybe they'd apply. And I just wish there was a way. I think there's a lot more we could do with the community.
Very nice.
If we can make that connection.
All right, for starters, I just want to ask my colleague Penny to find an hour when Ian and I can get together, and I'll go see him. Ian, what did HR say when you made the pitch?
That's a great idea. It's about 7 different versions of that over 12 years.
We will. I want to follow up in a conversation on this and get some more specifics. And then, by the way, and I don't know if you deal with this either. Sometimes at Cornell we use the word community, and we're talking about campus. And I always have to say, no, the community is there. You know, we're campus, and there's a community component to it, but the community is a community. I think we misuse the word sometimes, but my heart is in Ithaca. So we will talk soon. Thank you, Penny.
Thank you very much. There is a question about the arts and culture scene, and we've all been a little isolated. So is Cornell planning to restore the Cornell Theater program to what it was years ago?
Like which part of the theater program? The like Schwartz Center?
I'm not sure. Cornell Theater program.
Because there's different little niches of it, but I bet you we're talking about the Schwartz Center for Performing Arts, I'm guessing. I will find out. I thought about that the other day when I was walking through the war zone that's College Town Construction, and I'll find out and I'll get an answer to that. And I'm hoping that I can get the answers to the questions and route them through Community Foundation for starters, but anyone's welcome to reach out to me directly. My email's in chat. So thank you. It's a good question. I don't have a specific answer.
Sure. Gary doesn't have all the answers. Imagine that. Gary, could you talk a little bit more about the testing frequency that Cornell is doing, assuming this means obviously COVID testing?
Yeah, Penny, see if you can go to the COVID site and see if you can call up for students specifically, because the students are the primary customers in that thing, but anyone is welcome to like sign up for what's called surveillance testing, which sounds a little creepy, but it is what it is. So I get tested once a week. I mean, it's just sort of like it's a great thing you can do. Just get tested once a week and see how you're doing. But the students, they have to really follow through, or there's significant follow-up from the administration if they're not meeting the mandates, and often it's highest twice a week. Gets a little more intense when they're coming back from breaks, things like that. But if you went to our COVID site and looked at all the requirements for students, staff, and faculty are there. And as you can see, it varies from group to group. And then the whole concept of surveillance testing, and then broken down by specific demographics. So it's been an incredible organizational operation, and with no background to start that thing up. So the information's all on the COVID website in terms of what we're doing, how different demographics are involved. So I'm very proud of the work that Cornell's done with that, and it made it look easy, but it's not easy. I mean, the amount of juggling is pretty intense. Thank you, Penny.
Okay. Thank you. Yes. Now in the chat is the COVID testing link Penny just added. And 2 questions ago, yes, they were referring to the Sports Center program for theater. So thank you for answering that. Question about, could you talk about the relationship between your office and the new Einhorn Center for Community Engagement?
That is a work in progress. We have a lot of colleagues over there, you know, between Engage Cornell and the Public Service Center. I really respect that family for devoting so many resources to that. Our goal is to make the resources and the opportunities there as accessible as we can for the greater Ithaca community, because I mentioned before, I've worked at the Ithaca Journal for 10 years back in the last century. And I didn't know anything about Cornell until I started working there. And I think that, and I carry that with me every day. So I always try to provide clarity when I can. And when people ask questions, I get them an answer as quickly as I can. So I'm looking forward to the new era over there, for lack of a better phrase. And I think maybe with the help of the Community Foundation, we can actually do like a version of this on a Let's Talk sometime.
That'd be great.
I don't see any more questions right now. Thank you.
Gary, can you just mention, I don't quite remember the exact name, but you do monthly town halls or monthly reports to the community that happen the first week of the month. And I found those very interesting, useful. And I think more people could plug into that. Can you give us information about those?
Yeah, so there's a few things. We do a monthly town hall that my boss, Joe Molina, moderates. We just had one this week. We also do something called Town Gown Tuesdays, which is the first Tuesday of every month at 9 o'clock. And there's a community member coming in, and we bring in some folks on campus. We're doing one in December on mental health and different programs and how different demographics are doing. And that'll entail campus colleagues and then folks from town. So we do Town Gown Tuesdays. We have our monthly town halls. The dates on those vary. We're still doing our weekly radio show. We recently marked our 750th episode. And then we'll pull things together on specific niche topics as needed. So, and we always look for input from the community on like, hey, would it be worth it for Cornell to do something on, you know, any role they might have in the future of college town, things like that. It's been interesting. We're gradually starting to look ahead to whatever normal is going to look like again. But I find encouragement in that too. But COVID is still the driver on a lot of fronts.
Right. And speaking of looking ahead, let's look ahead just one semester. What will the spring 22 semester look like in terms of comparing it to pre-pandemic, comparing it to this semester, just in general with students and classes and testing and things like that?
I think the testing will remain in place. It's going to be interesting to see if the masking requirements change at all. I mean, that's guesswork. I don't even want to go there. We've been lucky that our enrollment's high, applicants are high, people want to come to Cornell. I'm very grateful for that because it's for a lot of different pockets of higher education, it's not the norm. We'll be safe, and we will do everything we can to never lose track of our impact on the off-campus community. And that's the most important part of my job. Yeah. Is representing and advocating for the greater Ithaca area. And I couldn't do that without inputs from many people on this call and then and others, because I always appreciate the honesty and the advice and the candor. And I know where it's coming from because people care so much about where we live.
Thank you, Gary, for being such a trusted professional partner, a personal friend, key asset, a pathway into a very large institution that sometimes can be somewhat opaque. You always provide that access and that conversation and that community connection. It's very valuable and appreciated, and does not go unrecognized by our community and certainly by the Community Foundation. Your entire staff, Penny and Kate and Sue, and I'm missing someone. Who else is in there?
We have two Kates.
Two Kates. Kate. Good. Really appreciate that very much. We're wrapping up our November Let's Talk with appreciation and thanks to Cornell University and Penny and Gary. I found this very interesting, very useful. I will put in the chat right now resources from previous Let's Talks. This recording will be posted there later today. It is archived all of our previous events, and our next Let's Talk is coming up on December 7th. The topic is immigration, presented by Cornell lecturer faculty member Steve Lair and our Community Foundation board member Kandakili Sakone. And there'll be additional Let's Talks coming up. We encourage you to let us know topics, speakers, and we thank you very much for taking time today to be with us and to continue to take such good care of our beloved community. Have a great rest of your day, everyone. Thank you very much.